everybody. It's 8 o'clock and welcome to another episode of Marvelous Medicine. Today, Dr. Vijay C Bose will be talking about health and fitness, basically how to exercise properly and get the maximum benefit out of exercise. Dr. Vijay Bose doesn't need an introduction to Marvelous Medicine viewers. His previous talk on food and eating was a runaway hit, and like we were discussing, it has had the maximum views on YouTube. Dr. Vijay Bose is the Joint Director and Consultant at Asian Joint Reconstruction Institute, Chennai. He did his MBBS from Madras Medical College and his orthopedic MS from Mangalore. He also did his MCH Ortho from Liverpool and FRCS from UK. His special interests are arthroplasty in young patients, hip resurfacing, and partial knee replacements. He has a huge body of work. He's a very sought after speaker in national and international orthopedic fora. He's a keen tennis player and a proponent of health and fitness. Post COVID, I think he's spent even more time in acquiring knowledge about health and fitness, and he's going to share that with us today. To moderate, we have Dr. Ashok Bade, who recently retired as the medical superintendent of JIPMA. He was previously the professor and head of anesthesiology and critical care at JIPMA Pondicherry. Dr. Bade did his MBBS, BA and MD from Government Medical College, Nagpur, and his fellowship in cardiovascular and thoracic anesthesia with the WHO. He received the Lifetime Achievement Award from the Indian Society of Anesthesia South Zone. The reason I asked Dr. Bade to be a moderator today is because he's an avid sportsman. He's represented Pondicherry Masters Group in badminton 8 times, and he was a national champion in the Masters badminton in 2019, though many of the competitors were a lot younger than him. Joining him is Dr. Nat Anand. He's a consultant dermatologist at Skin Research Center and RV Diagnostic Center, Chennai. He did his MBBS diploma and MD dermatology from JIPMA Pondicherry. He's a visiting faculty in several medical colleges in Chennai. He's an avid runner. He has completed 8 full marathons and several half marathons. He's also the trustee of Dream Runners and the head of Bessie Runners Group. Both these groups avidly promote new joinees and encourage people to run and also to train for marathons. Without taking any further time, over to you, Dr. Vijay Bose.
Thanks very much, Dr. Vidya and Dr. Patta. As I was just telling, the previous edition elicited a lot of response from all over the world. I got a lot of messages and things from that. So this Marvelous Medicine has been a great platform, I think, for an educational perspective. So thanks again. So just like the first edition of this talk, which was on diet and fasting, we're just going to outline the principles of exercise. We're not going to tell that this exercise is good, this exercise is bad, etc. It's for each one to decide what to take and what not to take. Okay. So with that introduction, I will share my slides. Good evening to the moderators as well, and a very good evening to all those people who are tuning in. So last week we gave an introduction of how we now have a comprehensive scientific template. So it has to be comprehensive and it has to include all facets of health, fitness, and wellness. We talked about last time. So, especially during the COVID times, we get a lot of WhatsApp forwards. And last week we covered, wellness and health intervention. What is health intervention? We covered what is sickness and disease intervention that we are all familiar with in allopathy, but we are not very familiar with what is wellness and health intervention. So, I'm sure all of you doctors have got this this WhatsApp forward that if you don't make time for your wellness, you soon have to make time for your illness. So as doctors, what do we do? Most of us, when we get a thing like this in WhatsApp, our social responsibility or our medical responsibility seems to stop by just us forwarding it to all the groups that we're a part of, and we think that our job is done. That of course is not the case. And I also want to tell that I understand that there are a lot of people who are listening in. There are 68 already. That some of you are not doctors, so I've tried to, although this talk is aimed at doctors, I've tried to take out all the medical jargon so that everyone can follow that. But if some medical jargon creeps in, please do excuse me for that. Okay. So
there are several others viewing it live on Facebook, sir.
Oh, I see. Okay, that's great. So imagine the situation in which this patient goes to and asks his doctor, how can I get cured of this disease? Any disease for that matter, So some disease. And imagine that the doctor gives the response saying, you go to the pharmacy, you get any small white round tablet and take it as many times a day, you'll get cured of the disease. If somebody gives this advice to the patient, what do you think? You think this guy is a complete quack, isn't it? We all would think he's a complete quack. Now, another situation in which the patient asks this doctor, doc, how can I get healthy and prevent the disease? We always get this question, some relative might have come for a joint problem to me, and then the relative, the daughter will ask me, doc, how can I get healthy and prevent this disease? And if I give an advice saying, eat less, move more, that's what we all doctors give. Now that is very similar to this advice. That's really quack advice. That really is not a scientific medical advice. Okay, so I think it's time has come for us in allopathy to spend more time in wellness, as we're all specialists of sickness, but we must also start spending more time on wellness. I think that's very important. Now I want to touch upon this concept of pseudo wellness, which I covered last time. So typical master health check that we see in any part of our country. This guy comes to the doctor, tight, I'm not able to wear my belt. And then you run some basic parameters like your fasting sugar is, it is 1 or 2, HDL is 40, TGL is 160, LDL is 140, BP is 130, 80. So we know that these are all very borderline. I mean, nothing major going on, borderline. So most of us in allopathy, because we are trained only in sickness and not in wellness, we will probably give this guy some amlodipine 5 milligrams, metformin 500, and atorvastatin 10 milligrams, and give our usual advice of eat less, move more, because we're trained only to look at the sickness aspect of it. Now, 6 months later, this patient comes back and we repeat all the tests, and the tests are all comes within the so-called normal range. And then the patient is happy, you are happy, the hospital is happy, everybody is happy. But this is pseudo wellness. Now, what you have really made this guy do is, this guy came to you at the start of a metabolic problem. So there was some fire somewhere and you could smell it. You could smell something burning. Now, instead of trying to quench that fire, but finding out what his real metabolic problem was, we just put some air freshener on it so that we don't see these parameters anymore. That's exactly what you should not be doing. So what they actually done for this is they put him on the slippery slope, and he is condemned to a lifetime of taking drugs by a handful to a state of chronic sickness. They condemned him to that. So it's very important to identify people who are on the start of a metabolic derangement. I mean, obvious metabolic derangement like this, we all know, but start of metabolic, it's very, very important so that they don't go along the slippery slope and get all these lifestyle disorders, and they are sort of, they have an entire lifetime of chronic sickness. So what we do is you do health intervention. Health intervention in a scientific way, not in an abstract way, but in a very scientific way. And that's what we call the comprehensive scientific template that we have now. Now remember that lifestyle disorders can be reversed if intervention is done before end organ damage. Now whatever the organ, all the organs implicated, that if you allow end organ damage to occur, then obviously reversal is not possible. So we must pick them up in this condition and initiate health intervention. That's what I've been stressing on the last talk as well. Now we have got a scientific template. It's not just a matter of feeling good with some exercises and things like that. We sort of tend to treat wellness and more lightly than what we do sickness, but must be given the same importance. Absolutely the same importance must be. I told you about last. Five key metabolic parameters, which are profile and not LDL. You want to do LFT and ultrasound and the blood pressure. These are the 5 key metabolic parameters. And then there are 10 key fitness indices. This is common for all disease or all organ systems. So we have the BMI, we have the waist circumference, we have the Vo2 Max, plank time, BFP, 1 rep max, balance score, flexibility score, sleep score, and bolt score. The last two, of course, is second intervention. We will not be covering it today, but the rest will be covering it today. So how do we get these scientific parameters for these patients? We now know how to dial the parameters that we have in our hands. Now, I told you last time how we can dial the diet and fasting to get these parameters correct. And today we'll talk about how we can dial these exercises to get these parameters, scientific parameters, to where you want them to be. Not just normal, but you want to be in the correct end of normal. You want keep improving these parameters to health, not derangement, and they will not develop any lifestyle disease. So the next question to ask is that, is health holistic or compartmentalized? Now, a science like Ayurveda, ancient science, on one end of the spectrum, and we have our modern allopathy, subspecialties, on the other end of the spectrum. So if we look at something like Ayurveda, they talk about the various, the Panchabhuta, the seven dhatus, etc. And Ayurveda talks about the harmony or the interrelationship between the mind, body, and spirit. Not only the mind, body, and spirit, but also the cosmos and the universe, how they're all interrelated and how our body is related to all that. That's what Ayurveda, the complex relationship, the harmony between all these elements is what Ayurveda stresses on. On the other end of the spectrum, we have like the American Heart Association, which gives this brochure for heart health. You're dividing the body, forget about cosmos and all that. We're subdividing the body that we have.
Dr. Bose, your audio is very unstable. Is it your internet? Or, I don't know. Your audio is very unstable.
One second. Just give me 1 second, please. Yeah. Yeah, now is it better?
Yes, sir.
Sorry about that. I knew that I was in the wrong internet connection. Yeah. So where were we? Yeah, okay. So we talked about this is health. Dr. Vijay, can you hear me better now?
Yes, sir. Loud and clear.
Loud and clear. Great. So we talked about how this, on one end of the spectrum, we have a science like Ayurveda, which talks about holistic medicine. On the other end, we have this allopathy, where we divide our body into various subdivisions. So Ayurveda means, of course, the life. Veda is sacred science. So Ayurveda talks about the relationship between mind, body, and spirit. Not only that, not only the mind, the relationship of the mind and body, the spirit, but also to the universe or the cosmos. So it's a very holistic. On the other end of the spectrum, we have something like the American Heart Association, where we subdivide the body into, heart health, liver health, renal health, etc. Now, which is correct? Is it holistic or health is compartmentalized? Now, remember that disease intervention can be focal. You can't argue against that. Now, if Pata has got patients with cholecystitis and he does lab chole, the patient is very thankful. Now, the cardiologist puts a stent in a patient who has got a ischemic chest pain. He's very happy. I do a knee replacement on a guy who's got knee pain, knee osteoarthritis. The patient holds my hand and thanks me. So what's cosmos got to do with it? It's just very focal. So disease intervention can be very focal. However, understanding disease and its origin is both focal and holistic. Now, somebody asked me, what can I do to prevent from getting osteoarthritis? And just say, take some calcium tablets and do his knee exercises. That is really not, you're not even close near the correct answer. So understanding disease and its origin is both focal and holistic. However, health intervention is always holistic. Please do not subdivide health into subunits. So we may or may not believe that harmony of body and mind with the soul and the universe is necessary for health. Some of you may believe that, some of you may not believe that. We can't argue both ways. However, you must at least not divide the physical body into subspecialty ones for health and wellness in allopathy. Please do not subdivide the body. So talking about heart fitness, gut health, mental and neuro wellness, women wellness, bone and joint health is absolutely spurious and a wrong way to do that. Okay. So that's what we fall into the trap of that. Health and wellness is holistic, unlike disease intervention. And all organ systems are integrally related to one another. Principles of improvement done through lifestyle is common to all organ systems. And if you think some focal intervention is some focal benefit, you're sadly mistaken. How can you
So there is still some problem with the voice, sir.
Problem with the voice?
Yes, sir. It's still cracking. I mean, the voice is breaking up and audio is like not great, sir.
That's the internet where that's the best that we can do. I cannot. We'll see how it goes. And just give me 1 second. And
just keep the mic a little far away, sir. It'll be fine.
I keep them far away now. Okay. Is that better?
Yes, sir. For now it's fine.
Yeah, Vijay, you have headphones which you can speak into.
I do have headphones.
You can try and change the audio to it.
But does it have a mic? Yeah.
It's an auto mic. Is it better?
Yes. Just try, sir. We'll check.
Does that sound better? Not really.
We'll try for a while and see, Vijay. Otherwise, then we'll take the headphones off.
Is there any better, please?
Yeah. Yeah, yes.
But I'm not hearing anything.
Now it's better, sir.
Oh, it's better? Okay.
Much better, sir.
Now I'm not using this. That's fine.
No.
So I think it's just an internet issue. Yeah. So just carry on like that. Okay, right. So we are telling that you must not divide the the body into various subdivisions for health. That's not a good idea at all. So suppose you tell if patient wants to say or a neighbor wants to know how you can be healthy, you cannot say you do this for heart health, you do this for gut health, you do this for bone and joint health. I mean, how many health can you take care of? So health is all same and universal. So based on the last talk, some of the people queried that if they just do the diet, would they be all right? Now the answer is no. Just by doing diet, don't fall into the trap by thinking a lot of people do that you just with a diet, you'll be able to get healthy and lose weight. You cannot do that. So there's a famous statement, one cannot out-eat a lack of exercises. The opposite is also true. One cannot out-exercise a poor diet. Now remember this very key point. If you depend on diet only for weight loss, you will end up being more unhealthy than you are. And that's the thing I want to highlight in this talk. A lot of things that we do as health that will make us more unhealthy than what we are already. So please don't fall into this trap. So the only way of doing it correctly is to follow a comprehensive program, taking care of all elements, and don't be focal in health intervention. The next question is that we all say, is any exercise good exercise? All the people that we give exercise saying, do more, eat less. So any exercise is a stress reliever. Any exercise will lubricate some joints to a certain extent. Any exercise is better than no activity in that it gives a sense of well-being, but it may not give metabolic benefit. The commonest mistake that people make. People think if you ask them to do exercise, yeah, I do exercise. But that exercise may not be giving them any metabolic benefit. The reported benefit may be placebo effect in many cases. So if we just do any exercise without any scientific basis, it has got very limited role to play. It doesn't have any serious role to play from a metabolic standpoint. So this is the commonest scenario that many women who come to the clinic say, doc, I work all day and I'm still fat. And there's no question, we cannot argue with them. They are working the whole day, no question about that. However, they are not aware of the exercise zones. These exercise zones are absolutely critical. And the heart rate zones during exercise signals are the signal that we give to the body. Just like last time we told you that when we eat, what we eat gives signals to the body to do various things. Similarly, the heart rate zone to which you exercise gives various signals to the body. For example, we'll come to maximum heart rate. But if you don't hit the 60% of your maximum heart rate, then you are telling the body that you're still in the conservation mode. The body tries to conserve all the fat and calories. You're not told the body that I'm going to do some activity and you need to spend all the fat and calories. You're not told the body that. And therefore, the body does not do that. So all these household activity, most of them at least, most people will be in this zone, which is less than 60% of your maximum heart rate. Therefore, the body still thinks that you're trying to conserve energy. You're not yet told the body that you have to expend the energy. So how do we know which zone to go? There's no question today that we need a fitness device. We need a fitness device to assess which heart zone that you are in while you're exercising. It's absolutely critical that you have today. Now, remember that parameters like sweating is not relevant. They tell you, sir, whole day I'm sweating, I'm doing work. Well, you're sweating, yes, especially in a hot climate, but that's not giving you any metabolic benefit. So I always compare it to a sphygmomanometer, where we suppose a doctor measures BP by just looking at the pulse volume without measuring the BP. What do you think of him? He'll be probably a quack. So you need an accurate measurement. So similarly for wellness, unless you have a modern device, a fitness tracker, you are not doing yourself. You're probably wasting your time. So we come to the four important dimensions of scientific fitness, which are, we call it the 4D or 4 dimensions: the flexibility and mobility, you have the muscle strength and bulk, you have stamina and endurance, and you have burn fat and calories. These are the 4 dimensions to scientific fitness. Now, here are 4 international athletes. They're all extremely good in one sport. However, they're classical examples of bad health. They're not healthy at all because they have skewed over focus on one component of fitness. They've been concentrating on one component of fitness, ignoring the others, and therefore they're poor examples of fitness. And if this is the commonest mistake made by beginners, they do, I go for a walk every day. Well, you go for a walk every day, but only one dimension of a scientific program. So you're not doing the others. Now, if you do the parameters we talked about, the 5 metabolic parameters and the 10 fitness indices, some will be great, but most will be abnormal in these people. Whereas if you take a compound sports like tennis or basketball or badminton, etc., those sports people will have ideal fitness. And if you do these parameters in them, they will show ideal values. So now we want to measure fitness scientifically, not just having a feeling of goodwill or feeling of, you feel good about it. You want to measure it scientifically. That's so important. So the 4 dimensions of exercises, the flexibility and mobility, we do yoga, calisthenic, Pilates, common things. There are other things also, but these are the common things done. For stamina and endurance, you can do a brisk walk, you can jog, run, swim, do whatever you want, as long as cardio. Cardio is otherwise known as LISS. LISS stands for low intensity steady state exercise. And then you have HIIT. HIIT is high intensity interval training. And then you have rested exercise with weights. So these are the 4 dimensions, and all 4 dimensions are absolutely crucial. It's just like the 3 macros in the diet. You cannot ignore any macros. If you just eat carbs, you'll end up unhealthy. If you just eat protein, you'll end up unhealthy. If you do any 1 dimension exercise, you will end up unhealthy. So not only are you not getting healthy, you're wasting your time and you're getting unhealthy. That's the point I want to take. Forget about getting healthy. But if you just concentrate on 1 dimension, you're getting unhealthy. So scientific approach to exercises, you have 2 principles of adaptability and reversibility. So in 2021, these are the minimum that you require for health. We are not living in primitive times anymore. You need to do something that's objective, scientific. So you need to have a fitness tracker. A modern one will cost you around 12,000 rupees. A standard one will cost you about 3,000 rupees. But you must have one. You must need a tape. You need to have a digital weighing machine. You need to have some weights or rested exercise. This is absolutely critical. You cannot get health without these requirements. Simple as that. So what is the principle of adaptability and overload? So suppose say I'm walking 2 kilometers every day for 6 months, I get fit. But if I do the same 2 kilometers over the next 6 months, I'm not getting the same benefit because I've been adapted to that exercise. I must increase that exercise to get fit. So imagine, so you must give some kind of an overload. Unless you give an overload, your body will adapt. It's a common mistake that people make. They say, I walked 1 kilometer for the last 5 years. Well, your first year was great, but the rest of the years were not great. What is the principle of reversibility? Remember, use it or lose it. Now, whatever gains that you make by exercises, whatever gains, you will lose it if you don't use it. If you don't stop the exercise, you lose it. And how fast do you lose it? Somewhere between half and 1/3 the time. So suppose you built your strength, by certain value. Now, half the time that you spend for building that strength, you will lose that strength. Okay, so use it or lose it. So we come to detail about the implications of intensity of exercise. So we talk about the maximum heart rate. Maximum heart rate is given a simple formula. Everything I'm going to tell is very, very simple, nothing complex in it. And everyone must be aware of this because it's all about your health. It is so, so important. So 220 minus age will give you your maximum heart rate formula. For example, if you're 50 years old and you find that 220 minus 50 is 170 is your maximum heart rate. Very simple. So you minus your age. And the same chart that we have. So depending on the heart zone that you're exercising, you will get different benefits. Just like, you'll get different benefits. So the signaling your body to give you different benefits. So that's so if you're on the 50-year age, then your key heart rate zones are 102, 119, and 136. So by altering your heart rate zone, you will achieve different benefits. That's so important. Depending on what benefit that you want to get, you will have to alter your heart rate zone of your exercise. It's as simple as that. Now, for this age group, I told you. So everyone must remember that what we call the 3 magic numbers for your own age group. So my age group is 50 to 55. So my magic numbers are 102, 119, 136. So you must always remember that 3 numbers. So for each age group, you have your own set of 3 magic numbers. So crucial to know that whatever you do exercise will give you the maximum benefit. Now, you also have to understand there are 2 types of metabolism, 2 muscle fibers, and 2 preferential targets in relation to exercise. This is not only for doctors. Everyone must be aware of that. Now, when you talk about aerobic metabolism, we burn carbs and fat in the presence of oxygen to get carbon dioxide and water. In anaerobic metabolism, as the name suggests, there is no oxygen involved. It's mainly carbs, and we get carbon dioxide, water, and also lactic acid, which gives you the anaerobic exercises. Now, if those of you are non-vegetarians will know the 2 types of meat that we eat. Now, when you talk about red meat, that is your type 1 muscle fibers that you have in your body. Red meat is type 1 fibers. Now, type 2 fibers are white. There's a different other type of meat. We know what are white muscle fibers. Same fibers we also have. Now, the type 1 muscle fibers, red in color, is a slow twitch fiber. It's only slow twitches. It uses small tension, but is resistant to fatigue. Another type of fiber, the white fiber, is a fast twitch fiber. It uses larger tension, but it's very prone for fatigue. So we have these 2 fibers. And we must exercise both these fibers. If we exercise only one fiber, it is not good. You must be able to exercise both fibers. Very, very crucial. There are also 2 targets. You can also target your exercises separately. It's mainly cardiovascular system, but not exclusively. And the peripheral target is muscle. So any exercises.
The audio is again bad, sir. We're not able to understand.
Audio is bad. That's just my internet connection today. So I can't see what I can do it.
No, continue, sir. No
problem. Okay, so those are the type 2s of muscle fibers we have. So it's very important to recruit both these muscle fibers, and we'll tell you how to recruit both these fibers. So the first type of exercise that we told about, we told you about the 4 dimensions. The first is LISS, low intensity steady state, or cardio, commonly called as cardio. And in this, you want to be in the heart rate zone of 60 to 70% of your maximum heart rate. We told you how to get your maximum heart rate. And this is your calorie burning action. So if you're less than 60% of your maximum heart rate, you are not burning any calories. Commonest mistake made by people saying, I go for a walk. You're talking with your friend all the time, going for a walk. You're not push your heart rate to 60% at least. Therefore, you're not burning any fat or calories. Common, you're just wasting your time. And once you push it past 70%, then not only are you burning calories, but you're building endurance also. So you're doing two things now. You're burning calories, and this, this is the aerobic metabolism that we talked about. It's a type 1 fiber, slow twitch fiber. It is red in color. That's what we have. So how do we do cardio exercises? You can do whatever you want. You can do walk, you can do jog, you can run, swim, do whatever you want, but these are all low intensity, steady state exercises. So as the name suggests, you find that it improves cardiovascular health. It's the only way to build stamina. There's no other way that you can build stamina or endurance. It's good for burning calories, but not the best. It's great for relieving stress and socializing outdoors. So you go for a brisk walk or a run with your friend, it's a great socializing thing to do. It's excellent to improve joint function. So what are the limitations of your list? So it does not recruit the type 2 fibers. It does not recruit that at all. So typically you'll find marathon runners will not have any muscle bulk. And therefore, if you just keep doing only this cardio without doing anything, you'll actually get worse than what you are. You lose all the muscle that you have. It's a quick adaptability. This is one exercise where you'll adapt very quickly. So you must keep on doing some kind of overload. Selectively overdoing cardio, like marathon runners, now proven to be very deleterious to health. Has very limited capacity to improve strength, as we told you. So doing only cardio, like many people do, is not good. So you need to have just like your diet, you need to have a good balanced exercise program to get optimal health. Now regarding cardio, you have this important parameter that's known as your Vo2 Max, and that measures your cardiorespiratory fitness. So Vo2 Max, the amount of maximal oxygen the body can consume, distribute, and use during maximal exertion. It is similar to the horsepower of a car. We know, different cars have different horsepower. So if I have a high Vo2 Max, that means I have a good cardiorespiratory fitness. So remember that Vo2 Max is not just about the heart and the lungs. It's also about capillary delivery and also about muscle efficiency. The whole thing is taken into account. And the only way of now that we do is you need to have a modern fitness device. Any of your modern fitness device, like the one that I have, will give you Vo2 Max. When I started fitness, my Vo2 was 38. Now it is 47, which is very good. So if you don't have a modern device, you can have a simple device, cheap one. And the substitute that we use for Vo2 Max is the resting heart rate. Now, our medical textbooks, we learned during undergraduate days that your normal heart rate is anywhere between 40 and 90. That's a huge range. So if you have a heart rate of 90, that may be normal range, but there's a very poor cardiorespiratory fitness that you have. So you must work towards doing cardio and thereby bringing your heart rate much towards the 40 mark. You must keep on doing it. If you don't have Vo2 Max, the resting heart rate is not a great substitute, it's an okay substitute. Now, is calendar age just a number? Now, we always keep saying calendar age is just a number. When we hit 50 and 60, this is true. The age that really matters is your fitness age. So suppose this person has got a Vo2 Max of 30, then their fitness age is 60. Suppose they have a Vo2 Max of 40, then their fitness age is 20. So that's the real age that matters, is not your calendar age, but your fitness age, which is determined by your Vo2 Max. So we have this tabular column for men and women. You can plot your, your Vo2 Max and find out what is your fitness age. So please be aware of your fitness age. So generally, you must be younger than your calendar age. If you're older than your calendar age, that's really bad news. Now, Vo2 Max has got correlation, a very good correlation with all lifestyle disorders. Now, if a 10% increase in Vo2 Max leads to a 15% decline in risk of heart attacks. So forget about taking medicines for heart attacks. This is what you need to prevent a heart attack. So whether it is liver disease, whether it is musculoskeletal disease, whether it's diabetes, Vo2 Max has got a strict correlation. And the American Heart Association says it's the most important overall correlate of health, the strong first predictor of cardiovascular disease, Vo2 Max. So please scientifically know your Vo2 Max, and your fitness age must be lower than your calendar age. So next we move on to the next dimension of exercise, which is understanding exercise. Dr. Vidya, is it better now?
Yes, sir. It's fine.
Right.
It's fine as of now. Yeah.
Right, okay. So we move to the second dimension, which is the understanding resistance weights. Now we talked about anaerobic metabolism. We talked about type 2, which is the fast twitch fibers, white fibers, fast twitch fibers. So you have to recruit them also. If you don't recruit, they will all waste and die. So you must recruit them also. So the only exercise that recruits type 2 fibers is your resistance and weights. You cannot recruit this exercise by doing aerobic exercises. Very important point. So most efficient way to build strength and bulk of muscle, toning and shaping of muscle occurs. The good news about this is if you do 2 to 3 times a week, it would suffice. Cardio, you must do more. This one, resistance and weights, you can do much less. That's good news. Now, what are the limitations of exercise with resistance and weights? You don't recruit the type 1 slow fibers. You do recruit a little bit, but not much. Does not build stamina and endurance. That's the biggest flaw with this. Can produce some muscle pain due to lactic acid. That we call as a muscle burn. Those of you who have gone to a gym will know what a muscle burn is. Now, the very important point I want to address here, should women and older people do weights? The emphatic answer is yes, 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 and yes. Why? Because we all undergo sarcopenia with age. Everybody talks about osteoporosis, but sarcopenia is much more important. So even if you don't do anything, even if you don't have any disease, even if you're normal, even if you're eating well, you will still undergo sarcopenia. For those non-doctors, sarco means muscle, penia means getting less. So you will undergo muscle degeneration just by aging without doing anything. So around 23, you have your maximum muscle bulk, and then your muscle starts losing its bulk and strength. So this is a very important slide. So at 23 years of age, you have your maximum muscle mass. And as we age, we all. So sarcopenia is a fact of life. You cannot avoid it fully. However, if you do resisted exercises, there can be a very distinctive change between how you end up with sarcopenia and how you can end up with exercises. There's a huge difference between the two. If you do exercises, continue exercises throughout life, your sarcopenia won't be that marked. There'll be a significant difference. Now, what does the difference imply? It has a huge implication. It depends whether you are going to be mobile in your old age. It implies whether you are going to be dependent on others in your old age or not. These two parameters are more important. I think more important than longevity itself. What's the point of living long when you're immobile and you're dependent on others? So this parameter, we talk about longevity in various drugs, increase longevity. That's all okay. But a much more important parameter is not about longevity. It's about a quality of life. And if you don't do any rested exercises, you'll have sarcopenia and you'll become dependent on others and you lose your mobility. This is more important than longevity. So how to strengthen bones? Patients come to all our orthopedic surgeons, patients come to us and always asks how to strengthen bones. And even I used to give this advice, and still a lot of orthopedic surgeons give advice. You take calcium supplements and vitamin D. Now remember that calcium supplements and vitamin D will work only when you have calcium or vitamin D deficiency. If I take 10 times the volume of calcium and 10 times the volume of vitamin D, my bones will not become 10 times stronger. That's a completely flawed concept. A lot of people are under this concept. So it will work only in people who have deficiency. But those who do not have a deficiency, it will not work. So we must stop considering the skeleton separately. We must always consider the body as regards to the skeleton as a muscle bone unit. We must not look at bone separately. So how do we strengthen bone? By strengthening the muscle around it. You strengthen the muscle around it, the muscle bone unit, the bone will also get strengthened. It's not by eating calcium or vitamin D, but doing rested exercises, you will strengthen the bones. Now, we know that sarcopenia and osteoporosis or osteopenia is close related. Muscle and bone strength is close related. Now we have a term for that. We call it osteosarcopenia. So we must always view both together, sarcopenia and osteopenia together. Just giving some drugs to treat osteopenia is a bad concept. Very bad concept. So you must view both together as osteosarcopenia. So if we deal sarcopenia with correct exercises, correct diet, you will also take care of osteoporosis. There's very little left. You will also take care of osteoporosis or osteopenia. So the next question people ask is, should everyone have access to a gym to do weight training? We talked about anaerobic and its importance. So I don't have access to a gym. Well, certainly you don't have to have a gym. As long as you understand the principles of exercises, there's no need to have a gym. And you need to have simple equipment, very cheap equipment. If you don't have anything, just use a school bag with some books in it. Understand the principles involved. That's all that matters. So if, for example, a kettlebell swing, it's an exercise. It involves all muscle groups of the body. So just by doing this one exercise, rested exercise, using weights, you can involve all muscle groups of the body. So as long as you understand the principles, there's no need to do. So just like your cardiac zones that we discussed in the cardio exercises, the important parameter here is 1 rep max. It is just like your maximum heart rate. So we want to know which zone you are exercising to get different benefits. Just because you do weights, it doesn't give the same benefit, just like the cardio. Different heart rate zones gives you different benefits. Different rep max will give you different benefits. So normally we talk about as a the percentage of rep max, but what is more important is how many reps is to do to get different benefits. For example, you have a given weight, say you have 10 kg, and I'm able to do it only 5 times. Then the 10 kg, I'm in the low rep range. Okay. Now suppose I have only 5 kg, I'm able to do it 10 times, not more than that. Then that 5 kg is a mid rep range weight for me. Now suppose I take only 2 kg and I'm able to do it more than 15 times, then it's a high rep range for me. Understand? Very simple. So the reps will give you different benefits. So if I use a weight for my fitness and I can do it only for less than 5 times, I'm building strength in the muscle. And if I'm doing a particular weight, which I'm able to do 10 times and not more, I'm building my muscle hypertrophy and I'm shaping my muscle. And if I do it more, I'm building the endurance of the muscle. Endurance not only is heart, you can also build the endurance of your muscle. Therefore, the common mistake, just like if you don't know your heart rate zones, you make mistake in cardio. Some people use a very low weight. They use 1 kg weight and they do it 30 times and say, I'm doing rested exercise. No, you're not doing rested exercises. You are in the high rep range and you are not building the muscle bulk. Now, we told you the importance of muscle bulk, sarcopenia. So you're not protecting yourself against sarcopenia. You're just building the endurance of your muscle. That's not good news. So suppose you're using your body weight as your resistance. That also can be done. Suppose you're doing push-ups. If you're able to do it 30 push-ups, then you are not building muscle with that exercise. So what you should do, you must get a school bag, put enough number of books so that you can do only up to 10. Then you are building muscle. Do you understand that? So important to understand the principles of exercises. And many people you find are wasting time doing exercise. And more importantly, many people are actually lowering their health status by not understanding exercises. So for everyone, start off, which zone you want to be? You want to be in the mid-rep zone or approximately 10 reps. That's the zone that you want to start off. The other zones are also important, but when you start off with the mid-rep zone. So how do you progress? How do you know you have made progress? Suppose you're 1 rep max, that's the maximum weight that you can lift only once, increases. That means you're making progress. AMRAP. Suppose for a given weight, you're able to do more repetitions. That means your type 2 fibers are improving greatly. Now, like 1 rep max, we also now have a 10 rep max. So if we're able to use a certain weight only 10 times, now we're able to do it 15 times. That means your muscle is getting better. You're protecting yourself against sarcopenia. Now we come to the third dimension of exercise, which is high intensity interval training or HIIT. Now this was found in Sweden about 50 years ago. When they found that instead of just running, if you mix it with a period of very fast running, the benefits are much better. So the principle is very same. Just like you're doing weights, by doing a fast running, you are actually putting a higher load. So the same principles of doing anaerobic exercises comes into play, just like doing weights. So this is like doing weights while running by doing a HIIT workout. So we do a low rep, high load. So just like how we are using weights, by this we can have a different benefit by doing a high intensity interval training. So again, the same chart comes into. So there are many exercises for HIIT that you can do, but the commonest one that people use is skipping, because you need to be stationary. You need to be looking at your fitness watch all the time. So it has to be stationary. So skipping is a common one, and a stationary bicycle is another common one that we do HIIT. So we want to hit the heart rate zone of 80%. So within 80 to 90%, then you go into HIIT zone. Okay. So this exercise, many people, when they find they have hit a plateau with cardio, you must move on to HIIT. You'll suddenly find once you start doing HIIT, that plateau disappears and you're able to make tremendous progress. So what are the benefits of HIIT? You have is tremendously time efficient. It's good for doctors. So 15 minutes of HIIT is equal to 1 hour of cardio, 4 times efficient. It protects muscle unlike cardio. Therefore, it's more selective for fat burning, whereas cardio will burn muscle also. Is most efficient in calorie burning for time spent. For given time spent, it's the most efficient exercise that we have today to burn your calories. 2 times a week is sufficient. So those of you doctors or very busy, HIIT is a great thing for you. So your effect lasts much longer after finishing a HIIT workout, and this we call as EPOC, or excess post exercise oxygen consumption. So even after you finish your HIIT program, you'll find that your body continues to burn fat and calories, which is great news. So those of you who are doing only cardio, please include some HIIT workouts. So how do we start HIIT for beginners? So all these apps are now available, whether you're in Google, whether you're in Android or in Apple, all these apps are available. So select one of these apps, and what you choose when you start, if you don't know about HIIT, is a work recovery ratio of 1:3. That means you will start with a 15-second work. So whether you're going to skip, you skip very fast. Are you going to bicycle, you ride very fast for 15 seconds. And then you ride slowly for 45 seconds. That's your work recovery ratio, very simple. And as you get better and better, you can keep increasing it, the ratio to 1 to 2, and then 1 to 1. It is very time efficient. So each rep takes only 1 minute. So if you do 8 to 12 sets, you've done your workout. It's similar to 1.25 hours of cardio. So 20-minute HIIT session will include warming up and cool down and HIIT program. So it's extremely time efficient, and it is more selective for fat burning. So people always say when you have very resilient belly fat, that HIIT works better to take care of it than cardio. The fourth dimension that we have is flexibility, mobility, core, and balance. So don't forget this important. A lot of women will just be doing yoga, for example, and they'll say, I do 2 hours of yoga, but still they develop some health problems. Well, you took care of only one dimension, you didn't take care of the other dimensions of health, and that's why you landed in problems. So flexibility is the ability of the muscle to lengthen passively, so not actively. So muscle contraction is not involved in flexibility. And the stretching, of course, we know it's important. It prevents injury, promotes circulation. And if somebody, if you feel sort of very lethargic the whole day, that means your flexibility is very poor. Try and improve your flexibility. Mobility is a little different. Mobility is active. Muscular function is involved. And the 3 common programs that we have are yoga, Pilates, and calisthenics. There are others also, but these are the common ones. So the important thing about flexibility is that there is no one doing reps. That's an important concept. So how do we increase flexibility? There are 8 basic stretches that you do while you're standing up. You'll see athletes doing these stretches whenever you want to watch them on TV. And there are 8 basic stretches that you do on the floor. It takes only 10 minutes to do the stretches. Or if you don't want, you can do Surya Namaskar and yoga, which takes care of all the stretching routines in one go. So very time efficient to do Surya Namaskar. Now the Indian government has finally woken up. Last year it has given us guidelines of how to evaluate patients and people for fitness, not only for illness but fitness. So these are guidelines released by the government of India. They released a booklet called as Fit India. And in that they talk about 2 tests, the back scratch test for flexibility and your sit and reach test for flexibility. And you have your scores here. Find out what your scores are. It's all available online. And if your score is poor, it's high time you start doing some flexibility and quantifying it by these charts, which is available in the Fit India, available online. Now, those are Now the common mistake to do in your mobility and core strengthening is to concentrate on one aspect. Now remember that there are two chains in the body, the anterior chain and the posterior chain. Anterior means front, posterior means back. So you have the anterior chain and the posterior chain. So when you do all these static postures, the common mistake is to focus on only one group. So if you concentrate only on the muscle in the front of the body, you will create an imbalance. That's not good. So you must make sure that you engage the anterior chain as well as the posterior chain. It's very important concept. So the static postures are there. I'll tell you about 4 basic postures. So the plank is the most common thing that we do. If we do plank, you must also do a reverse plank. Otherwise, you get imbalance. Very important. And if you do a boat pose, you must do a bridge pose also. And if you do a cobra pose, you must do a fetal pose also. And if you do a Superman hold like this, you must do a hollow body, the reverse. So you must do not make the mistake of strengthening anterior or posterior and ignoring the others. You'll create a muscle imbalance and you probably end up damaging the body. So you must have a balance of these. Okay. Now don't remember the side muscles. Okay. Side plank also is important. Now you must hold these postures for as long as possible. Now if you just do these 4 things, that's enough. That's enough for building your mobility and core strengthening. Just 4 is enough. Unless you want to train somebody else, you want to become a trainer or something, just these 4 postures will do. Now, how do you identify somebody has got poor mobility, not flexibility, poor mobility? Now, flexibility, I told you the 2 tests that we do for flexibility. Now, mobility is that when you're not able to do a deep squat hold, that's a deep squat hold, okay? Or somebody stands with a poor standing posture. Now, you must not stand like this with all these curves. So, you must be able to do a full squat. If you're not able to do a full squat, your mobility is very poor. And it's high time you start working on your mobility. And your posture must be like this, straight, not like this. If your posture is bad, that means your core is bad, and it's high time you start doing something about it. So how do we quantify mobility and core? By doing what's known as plank time. So we told you about plank. So the important thing about plank is that your butt must not be higher than your thigh. It must be in the same level like that. And how many seconds you hold this posture will tell you your plank time or how good your core is. And remember, we're doing everything on a scientific basis, and you must quantify your core. And you can see this charts are available, and you must be at least in this level for having a good core. Good core is absolutely important. So I'll talk a little bit about core. The core is the area of the body which is commonly referred to is the midsection. So both the front, the back, and the sides, the midsection. So the top part of your glutes, the lower part of your trapezius are all parts of your core. The core is the foundation of the body from a functional standpoint. All compound movements of the body originate from the core or passes through it. For example, if I do just biceps, that's not a core. That doesn't originate from the core. But if I do a throwing, then the core has to be involved. The core is the functional base of the body. A strong, flexible core underpins everyday activity. If you don't have a strong core, you'll suffer in everyday activity. A weak core will impair the spine, and the commonest cause of back pain. If you don't have a core, you're very prone for injury. And if you start doing all vague exercises without strengthening your core, then you have a high risk of injury. So please pay attention to your core. And how do you know your core is weak? You can't do a squat. And how do you quantify it? By doing a plank time. Now, core strengthening involves 3 things. You need to do static mobility poses we talked about. We also talked about dynamic exercises that you need to do. And also you need to maintain posture at all times. Whether standing or sitting, you maintain posture, that itself will strengthen your core. Now there's something else known as core stability. So if you add a bit of coordination, for example, just not standing on a plank, but you take one arm or one leg off, then you're adding coordination and balance. That gives a new dimension to core strength, and that we call as core stability. For core stability, we start involving the pelvic floor muscles, etc. So even for women, if you have core stability, you will not get all your gynecological problems. So don't focus on women's health and just give them pelvic floor exercises. It doesn't work that way. They have to increase their core stability for pelvic floor exercises to work, etc. And you can add an exercise ball or a gym ball, call it. Once you do these exercises, you add a gym ball, you add both coordination and balance, and thereby we improve core stability. So the popular routines to improve this is, we talked about static routines. Now these are dynamic core. So the classic crunch. The opposite of that is spinal arching. You can bicycle, and the opposite is of mountain climber. So very simple things, but that's enough. You do a leg pull, alternate leg pull, and then you can do a side crunch as well. So very simple exercises that involve both change and just these 4 exercises enough. You don't have to do any fancy. You do it, you get excellent core training. So posture, dynamic strength, static strength. So next we go to balance. What's the importance of balance and how do we quantify it? Now, balance also we lose with the age. So very important to balance exercises so that we don't use balance. Now, balance is very important for preventing falls. Every day we see fracture neck or femur that occurs because they fall for a lack of balance, and it builds better posture and improves core stability. So whenever you're doing any standing activity during the day, whether you're doing cooking or you're a surgeon, you're operating or you're standing in your office, then a good time is to stand on one leg. That will improve your balance. That is the most fundamental of that. More advanced exercise would be a stork, standing on one leg like that, a flamingo standing on like that, or a warrior 3 pose. These are common for yoga, calisthenics, Pilates, etc. So you must have some balance routine that you must do so that your balance is very good. Now again, the Government of India, Fit India book gives you this test to quantify it, and that's called as a standing stork test. So they give the name. So how many seconds you can stand like that. And if you find that you are very poor, it's time to start doing some balancing exercises and get your balance going. Okay. What are the cardiac implications of exercise? Now we talked about this brochure from the American Heart Association earlier. So how we divide health into various subdivisions. So the American Heart Health Association, this one. Now we know that when we have visceral fat, it's bad for the entire body, is bad for the heart also. Heart gets fatty infiltration, so we don't like that. But if you don't have fat, and who has the healthiest heart? So all these 3 guys do not have fat, obviously, but who has the healthiest heart? That's what we're interested to know. Now, this marathon runner, because they're overtraining one segment, one dimension, they will have a volume overload and they'll have eccentric hypertrophy of the heart. So that's just not good. This bodybuilder will have a pressure overload and you'll have a concentric hypertrophy of the heart. That again is not good at all. So somebody like a sprinter will have toned muscle and therefore you'll have an ideal heart. So all these sportsmen, they are all high-level sports people, but they will have a poor heart because they select only one aspect of the fitness. Now remember that there are a lot of reports now that marathon runners who don't have any muscle in them. Look at a smaller muscle, and then you find that actually your cardiac, you think you're doing a good job, but actually you're doing a very bad job if you're losing muscle by selective cardio training. And all these bodybuilders, recently we had from Tamil Nadu, a young bodybuilder, only I think 2 days ago, he passed away, 35 years old. He won the world championships a couple of years ago. He passed away due to a cardiac issue when he was 35 years of age. So why bodybuilders die young? So remember that just because you're doing exercise doesn't mean it's good exercise. You must understand the science behind exercise and do the correct exercise. So keeping good muscle, toned muscle is the key to the heart. So skeletal muscle and heart muscle, both are striated and the same response to exercise from metabolic standpoint. So whatever that you do to build peripheral muscle, you are doing the same thing to build heart muscle. Keep that in mind. So you don't need to do selective heart exercise, not required. As long as your peripheral muscle, skeletal muscle is nice and toned, the heart muscle will fine. So there's no need to do scans to assess certain parameters. A simple mirror will tell you a lot of things. So if you stand there in the mirror and you have his belly fat, you don't need any scan. It will tell you that it's the exact mirror image of your visceral fat, how much fat lies inside your abdomen. And that we know is really, really bad, toxic. Now, if you have good muscle, you stand before the mirror and if you have good muscle, good toned muscle like this, it tells you got a good heart muscle. It also tells you got a good strong skeleton. There's no need to any scans. A mirror will tell you what lies inside your body. Just a mirror will tell you. So don't take this lightly. So don't fall into this trap, thinking that I'm not young, so physical appearance does not matter to me. Physical appearance does not matter to you, may not matter to you, but your health matters to you. So looking good is not just a matter of appearance. It's truly a matter of health. I can't overstress that. So taking fitness to the next level is a very important point, this concept. So there's a honeymoon period. Whenever people are obese, then they undertook some initiatives, they do some exercise, they modify the diet, etc., some fasting, and then they experience weight loss. And that first initial period when they're excessively heavy, we call that as the honeymoon period. So in that honeymoon period, weight loss equals fat loss. So that's very good, very excessively fat. However, once you cross that honeymoon period, things become a little more complicated. So here are two people, both started at 90 kg, now both are 80 kg. Now this person has undergone healthy weight loss. This person has undergone unhealthy weight loss. Unhealthy weight loss means you're worse than what you were before. So not only did you waste your time in exercise, you did something bad for yourself. That's the point I'm trying to stress. So this person who has undergone unhealthy weight loss, as fitness level has gone down, he has got decreased strength and stamina now. His performance is poor. He is prone for early aging. He's got reduced immunity. He's got sagging skin. Whereas this person who is here has earned this weight loss through correct nutrition and proper training. So he's got an improved fitness level. He's got great strength and stamina. He's got peak performance. He's delayed his aging. He has reduced the risk of diseases. His skin tone remains intact. So weight loss can be healthy, can be really unhealthy as well. So don't just get overexcited about weight loss once you cross the honeymoon period. So what are the signs? Very, very important. I want to stress for everyone. Signs indicative of muscle loss, and fat loss. Important points. Your workout feels more strained than usual. That means you're losing muscle. Instead of being full of energy when you're burning fat, you're now depleted while fasting and work hours. Your resilient fat areas in the body, like your abdomen, remains the same. You have sagging skin. Your sleep deprivation can also cause muscle, and your muscle girth is decreasing. These are all the signs to say you're undergoing unhealthy weight loss, and you must certainly look into it and try and modify it so that you undergo healthy weight loss. Now, this is the chart that we have for what we call as the body fat index. It's very essential that we know this. Very simple chart. So the women is always one segment higher than men. So for example, obese, with regard to body fat percentage, will be 30 for men, 35 for women. Similarly, everything will be one segment higher. Now, only when you're obese, your fat will protect against muscle loss. Once we cross that obese period and your body fat percentage comes down, then you got to be careful. You should not go into unhealthy weight loss. So how do we estimate body fat percentage? There are a lot of ways. You can use body fat percentage calipers. There are apps in your smartphone, and you can put in some parameters and calculate a BFP. Your DEXA fat scan will tell you your BFP. You can have these charts. They're fairly accurate. Tell you what your, and probably the simplest way to do it, tell you what your body fat percentage is, or you can use specialized scales. Now, the DEXA is probably the most accurate way of doing it, and probably the most inaccurate is your specialized scales. So these charts probably are the best option that we have now. We can also use this calipers. Now, understanding the basics of fat loss, very, very important, because a lot of people make mistakes. So our body, has predominantly is made of protein. It also is made of some fat. So fat is, don't think all fat is bad. Fat has got an important function in the body. So there's some fat, there's hardly any carbs as far as the structure of the body goes. Now, when you take in carbs is used for activity, that we know. Now, protein is what that's used for building the body or structure. Now, fat is used for both activity as well as body structure. For delayed activity, you want late energy, you need fat. And for structure also, we need fat. Now, rule is any macro, any of these macros that you eat in excess will be converted to fat for storage. That's rule number one. That's why that The proportion is absolutely crucial. Proportion is absolutely crucial. That's why we stressed in the last talk. If you get a proportion wrong, then you'll find that you'll end up being fat. The excess macro, whatever macro it is, gets converted to fat and gets stored. Now, we consider various scenarios. In scenario one, you have carb intake, you find is more than your activity requirement. You're eating too much carbs, you're not doing activity. Then what happens? You start storing fat, especially an unhealthy way to store fat. Now, scenario two, what if carb intake is less than your activity? Your carb intake is less than what you need. Then what happens? Your grossly excess fat is used to make up the deficit. So fat is now used for energy. Okay, that is when you're grossly fat. Scenario three, when you still have more of a carb deficit, you still cut down on your carbs. What happens? It is not only the fat that goes away, but also the protein or the muscle also goes away. Very important point. And that's why you end up losing muscle. Very important point. So how do we maintain muscle during weight loss? Everyone must know how to maintain muscle during weight loss. So we dial in what we eat, the proportion of the macros, dial in our fasting period. Each body is a little different, so we must learn to dial it. And then we dial in the exercise program as required. Therefore, we maintain muscle during weight loss. So there are rules to avoid unhealthy weight loss. Very important rules. Number one, if your deficit is large, if you don't eat well, you lose muscle. If you avoid carbs fully, you will lose muscle. If you have protein deficit, you will lose muscle. If you do not do anaerobic rested exercises in the mid-rep or low rep zone, you just do some low weights like this, you will not prevent muscle loss. Too much cardio, focusing only on cardio, especially impact cardio like running, will make one lose muscle. Doing cardio during fasting, whenever you're fasting and doing cardio, you will lose muscle. Lack of sleep and excess stress will make one lose muscle. Very important rules that everyone must be aware of. So sleep deprivation has been well proven that it will cause fat deposition and muscle loss if you deprive yourself of sleep. So not only these primary interventions are important, but secondary interventions like sleep optimization and rest restriction are so important to burn fat and preserve muscle. So we almost come to the end of the talk. So what about extreme muscle hypertrophy? I'm sure none in this group does so, but this may not be, as I told you, you may win some medals, but certainly not healthy from a metabolic perspective. But why I'm talking about this is you must understand the principle behind it. So there's a popular quote in bodybuilding that losing fat while building muscle. Now you're losing fat at the same time you're building muscle. And that is called as recomposition of the body. It's more of an art form than a science. More of an art form than a science. Now, bodybuilders will talk about bulking and cutting. Now, I'm not telling you how to build your body. I'm just telling you the metabolic principles involved. So bulking means the bodybuilder will go into a calorie surplus. He will not do any cardio. He will do a higher volume exercise with low reps. He will eat adequate protein. When he's cutting, that means, he's taking the fat off, otherwise called as shredding. He will go into a calorie deficit. He will introduce cardio. He will do low volume and high reps. He will eat adequate protein. And that's how bodybuilders will first do bulking and then cutting. Now, I'm not asking you to do bodybuilding, but you must understand the same principles of how they use what variables that what we eat, how we fast, and how we exercise to achieve different benefits. That is the same principles that we also should do, not for bodybuilding, but preventing muscle loss during weight loss. This is a classical example of how bodybuilders will do that. So first they will bulk up by doing this, and then they will cut by doing this. Same metabolic principles are involved. So how much exercise must one do? Commonly, you must have heard people saying that you must get at least 150 minutes of exercise per week. Now that is true, but that refers only to cardio and HIIT. So you must do rested exercises. Plus you must do flexibility, mobility, core, balance exercises. So it's much more than 150. 150 times is not enough. So that's a typical chart that you need to have. So putting all together, roughly you will need about 10 minutes in the morning and about 40 minutes in the evening. 1 day of rest is compulsory for everyone. So you roughly need 40 minutes in the evening, 10 minutes in the morning. You can do whatever you want. You have more time in the morning, you can switch it around. You can have your own way of doing it, but that is the minimum requirement that we need to spend. So we come to, so by altering this, we just don't feel good. You have to make sure that your 5 key metabolic parameters are improving and your 10 key fitness indices are increasing to the best optimal fitness. That's absolutely essential. We come back to the first slide. That if we don't make time for your wellness, you'll be forced to make time for your illness. So I thank you for your attention. Thanks, everyone. There have been nearly 123 people. Thanks very much. I'll stop sharing now.
Over to you, Dr. Bade.
Hello.
Yes, sir, we can hear you.
Yeah, you can hear me?
Yes, sir.
Yeah, thank you, Dr. Bose, for giving an excellent lecture on how to do exercise and how it is going to benefit. But if you permit me, I will add a few things which I think should have been also stressed. One is meditation. I think meditation does help in your mental health, because when you talk about health, it is a holistic health, physical, mental, spiritual, everything. So meditation does help in concentration, in whatever you are doing, concentration also. So I think
there is no question about that, sir, certainly, but we are coming to that to the part 3 of the talk. Yeah. So this is the part 2 is only exercises. And then part 3 is, we talk about breathing, meditation, stress reduction, sleep, etc. So that's part 3 of the talk, but that's very, very important, absolutely important.
Another thing, I think you talked about exercises for most of the parts of the bodies, but the most important was neck. I think neck exercises have to be also stressed, because without that, we have a lot of problems. Like as you go beyond 50, 55, you will see a lot of people have neck problems. So if you miss neck exercises, then it becomes a problem.
Fully agree with you, sir. Neck exercise, very, very, very important. Absolutely, yeah.
Yeah, I thought that is a very important part. So you can do whatever way you want, yogasanas or whatever you feel like, but neck exercises one should do every day without fail. Third thing I will like to stress is you showed all the parameters, so much you measure Vmax, but a simple way to know whether you are healthy or you are fit or not. See, because finally you want to know whether you are fit or not. You cannot keep on measuring Vmax and all that every day. So what I think is every individual has got a unique potentialities. You cannot standardize all people will be same. So what we have to see that whether that person is able to function or perform physically, mentally, socially, and spiritually to his full range of his potentialities. And then we can say that he is physically fit or healthy. Another way of knowing is when you get up in the morning, what do you feel? You have done a lot of exercise in the evening or any time, and how do you feel in the morning when you get up? If you are feeling energetic, you are feeling alert, and you are able to carry out all your activities without any problem, that indicates that you are a very healthy individual and your fitness. Even the CDC, that is the Central Disease Control Prevention, defines fitness as ability to carry out daily tasks with vigor, alertness, without undue fatigue, and with ample energy to enjoy leisure time pursuits. See, one should also remember that you should be able to enjoy leisure time pursuits also, and to respond to emergencies. So if you are able to do all this, then I think one is a fit. And I think mental health also has to be taken care of by trying to concentrate, trying to do meditation, and trying to get a good sleep. That is very, very important with whatever type of exercises you are doing. If you get a good sleep, then definitely whatever exercise we do will give the benefit most and will keep us fit and healthy. I hope you will agree with me, Vijay Bose.
Yes, absolutely, sir. Agree with that.
Dr. Vijay, thank you. Very comprehensive. Because as a marathon runner, I will this thing. I absolutely agree with you that marathon running is not for everybody. It's for those who have been trained, and even if you are trained, it does reduce your cardiac life. That's a known fact. But there are certain key rules in marathon running. Of course, I swear by my mentor Tim Noakes, whom I follow quite a lot. Tim Noakes is a sports medicine specialist from South Africa. He's written a beautiful book called Lore of Running. It's kind of a Bible for marathoners, so I go by that. The training art of not fatiguing your running is, as you already said, we mix things. Like somebody asked, how do you mix things? Like I can just share you a chart of my running group. Incidentally, our running group has got more than 1,500 runners, and I'm head of the training. I'm head of the training for the group. But we don't run marathon every month. We limit itself to once a year, so that we don't hurt. And basically, during the rest of the year, you try to limit your running to less than 32. That's the scientific limit for running in a week to prevent any cardiac injury is 32 kilometers per week and not more than 20 kilometers per hour pace. And most of us don't run that fast, so you don't have to worry about that. Yes, it involves a lot of weight training. We do a lot of weight training, we do a lot of Pilates, and we do a lot of stretches. So basically, somebody asked, how do you do it? Just say, I'll just put a chart just to show how a training program looks for runners. It just kind of, this is what I make these training charts for our group. We have a full-time coach, and as you can see, 2 days a week, we do HIIT or resistance body training or medicine ball or weights. And we have, most important, as Dr. Bade said, Monday is always a rest day and Saturday is always a light day. So yes, the rest is quite underestimated. A rest to recover is as important as the amount of effort you put on rest. And thank you once again for reiterating whatever I have been reading. Thank you so much. There was somebody who asked a question about, yeah, somebody who has got a metabolic problem already. He was asked a question, is it right for me to force myself to 70% of my capability? I think you can answer that, sir.
Yeah, obviously, when you have a pre-existing disease, a heart disease, etc., then first you need to take care of that, and you must do under supervision of the doctor. Now, this one that we are now telling you, people who are so-called get normal MHC values, you underwent an MHC and everything is normal, so you don't have any disease, but that doesn't mean you are fit. You need to get fit by various methods. But suppose you have any other problem, whatever may be the problem, you first need to get it addressed, and everything has to be done under medical supervision. That goes without saying. So today's talk is only for people who do not have any pre-existing disease. They don't have, therefore they are in a state of pre-disease. They don't have any disease. And if you just leave it like that, you'll go into disease. So you want to do something that they never get into disease. And that's what the whole focus on. Coming to your point on marathon running, I totally take, sir, that done in a scientific way, cardio running is very good, as we showed in the chart. But absolutely correct, and I'm sure that your running giving you a lot of benefit. But the picture that I showed, once you start competing in marathons, all the marathon runners will not have any muscle. It's like bodybuilding. That is bad when you lose muscle. But when you're having good muscle, when you're doing the entire spectrum of exercises, long running is very good. That's how you develop endurance. Fully take your point, sir.
I'll add that for the competition, very important, sir. When we start becoming competitive, a different set of neurohormones are released. It's like fight or flight and competing. When you start running with an enjoyment, with fun, it's a different sense. So there's one where there's a competitive stress is always bad for you. When you keep thinking, I want to improve my timing, I want to run faster, I want to be faster, that's a stress on your body. Whereas if you say, I'm going to run for fun, I like it, and that's good for your health.
Absolutely.
And I would like to add one more point, that whatever exercises we do, it should be regularly done. That is very important. Just doing for 15 days and then leaving it off, then after another 15 days you try again. But regularity in exercise and rest is equally important.
Yes, sir, that's what he already said. If you don't do it, you lose it very quickly.
Yeah. Don't use it, you lose it. Very important about exercise.
And another thing, exercise is addictive, sir. You don't have to worry about it. It's a slow, addictive process. And when you start doing that, it comes. That's why some people lose the this thing balance, and they start doing too much. There are many marathon runners who start doing 60 kilometers, 70 kilometers a week, and that's not good for them. So you need a balance for that.
Absolutely, yeah.
Telling no, it is addictive. That is mainly because of the endogenous endorphins that are released. They like exogenous morphine, other drugs. So it is like endogenous endorphins, no, that make you every day the exercise.
When you like it, it's endorphin. When you don't like it, it's epinephrine or epinephrine, and you start becoming competitive, and that's not good for you.
If anyone else wants to ask questions, I think we can.
So unmute yourself and ask a question. Even if you have not typed it in the chat box, please feel free to unmute yourself and ask any questions. Have another.
Vijay, can I ask a question?
Absolutely.
Sure. So one of the things that is always concerning, and particularly for those of us who are 50 plus, is the possibility of injury and injury prevention. So what would you recommend that people do the most? I've heard some of the trainers in my gym suggest that a good core is the best way to start to prevent injuries. Is that something that you see in your experience, or is that just this one trainer's view?
Absolutely, I did mention that. So the core is the functional base of the body. So all complex functional movement arises from the core. So it's very important to have core strength. Not only core strength, you must also have flexibility. So if you don't have flexibility and do certain activities, you're really prone for injury. If you don't have the normal range of movement that the joint must go through, that's important. So you, for beginners, you have to concentrate on core strength and flexibility before you move to other more strenuous exercises. Absolutely. To prevent injury, core strength, flexibility. Those are things that we want.
Tarun, you had a lot of questions on the chat box from the beginning of the talk. Have almost all of them been addressed, or you still have any questions left?
Ma'am, I have one question. Like, which app Dr. Bose will recommend us for HIT?
Don't need any name of the app, but all the apps are good. As I told you, it's very simple. Start slow, 15-second work, 45-second recovery. So that's all you want. Whatever you, suppose you're doing stationary bicycling, 15-second you very fast. The app will give an alarm. 15-second is over. Then it will give another alarm when your 45-second rest is over. So many apps are there. Any app is fine. And then you do a reps for about 8 to 12 times. So for a very short period of time, you got a exercise similar to a cardio workout for 1.25 hours. So for people who are very busy and all that, it works very well. But even people who are not busy, just doing cardio is not enough. You must include HIT into your diet of exercises.
And sir, which gadget do you recommend? Like, which watch do you recommend?
Now, I don't want to sound commercial or anything.
I might put it this way: don't get into gadgets; it'll catch you very quickly. You have a gadget to measure it, that's fine. But once you start getting into gadgets, the gadget grabs you.
But the bottom line is any gadget that measures Vo2 Max. That's the key thing. Is a good gadget. Other things are can only measure heart rate, which is okay. But if you are serious about your health, buy a gadget which will measure your Vo2 Max. Then whatever may be the make, it's fine. It'll be good.
So one question I wanted to ask: this year said that kettle swings are
kettlebell.
They involve almost all the muscle groups of the body. So what would be a good weight of the kettle to get for a beginner? Or should you get...
Well, typically, women start with around 6, and men start in the region of 8 to 10. That's where you start off. So unlike your rep max, you cannot really know your rep max for a kettlebell swings. And generally, once you become very advanced kettlebells, you'll need 3 kettlebells for all your requirements. And of course, as you become better and better, the 3 will change. So you may need to buy more. But all that apart, for men, you start around 8. And for women, you start around 4 to 6. That's the rough. And you find that you are able to comfortably do lots of reps, then that's too light for you. You need to go to a higher kettlebell.
Dr. Vijay, is it pounds or kilos?
It's kilos.
Okay, kilos. One other question about VO2 max measurement.
In India, yeah.
Do you prefer the chest thing for heart rate measurements? So because there are several, like I think the Garmin one uses the chest thing for heart rate and then calculates the VO2 max using that. I've read a lot of things, and again, my trainer keeps telling me that the chest thing is better for heart rate than a wrist one.
Yeah, professional athletes, and we also have a lab. Professional trainers, they sports medicine. Once you go into the spectrum of sports medicine, then they have very complex things to measure your VO2 max. But just like anything else, for example, SpO2, a small device now gives you SpO2 quite reliably. Earlier we used to have big gadgets for SpO2. Now your small gadget gives you. So your watch has become very accurate. 2021, your watch is very accurate. But at the end of the day, it's not the specific measurement that matters. As long as you're making improvements in VO2 max, you're on the right track. If you are having an unhealthy fat loss, or unhealthy weight loss, then your VO2 max will probably be coming down. So it's a very good tool to monitor, but all the modern devices are fairly accurate. So you can go to all the sports medicine, but no need to. The whole focus of the talk and my advice is for common people, you and me. We don't want any fancy gadgets. We don't want any fancy formulas. We want, simple things that is universal. That's what we want.
Dr. Krishnamurthy, you were very much influenced by Dr. Vijay Bose's previous talk. So would you like to say something? Kimo, are you there?
Yes.
Yeah, Krishnamurthy, it's so nice to see you.
You're muted, Kimo. You need to unmute yourself. No, again you got muted. Yeah.
I think this lecture was so much to grasp. I think it'll take me another 1 month to do research on each one of the slides. Dr. Bose has got a habit of making sure every square millimeter of his slide is covered with some stuff which you don't know. So I think I have had about 5-6 kilometers, like a marathon, like Anandnath marathon amount of knowledge which I didn't know. So I have a feeling if I could get the slides later from Dr. Vijay, if he will willing to share it again, I will take my, this corona enforced lack of activity to go into that and see what I can do. But Dr. Bose, thanks to your last lecture, I have slightly changed I'm eating differently. I'm exercising differently. Of course, now it looks as though everything I'm doing is totally wrong. I have to change again. And I have lost quite a bit of weight, around 3 kilos weight. And I've also lost around 3 centimeters around my waist. I'm very grateful to you for changing me over this time. And I'm very sorry to find that the government of India doesn't worry about people over 65. They don't have any indices, so it doesn't matter to us. So thank you very much.
So good to know, Krishnamurthy, that you have made excellent progress.
I must have been the one guy who has studied your slides in great detail last time. I know that there are from three different lectures, and I can see the slides. I wish I had all of them together in one shot. You have done We have done a wonderful way of amalgamating everything and presenting it.
Dr. Ashokan, would you like to say something?
Yeah. I see in the lighter side of life, I have seen I prefer non-stationary cycle, because what has happened, whenever I go and see my friends, I see a stationary cycle in their house, and it is generally used
for hanging clothes.
For hanging clothes.
And I think all of us must have seen. And the additional advantage of the non-stationary cycle is you are in the open air. So that is also more beneficial if you are in the open air. So,
I'm not so sure. And if you are on the floor, then there may be a problem. I don't think we have cycle areas there. I mean, if you have a good area for cycling, it will be good. But I'm mortally scared to walk on the roads.
So they serve different benefits. Yeah. So outdoor cycling is a great cardio exercise, highly recommended. But you cannot do a hit program. The road you cannot go suddenly fast. I mean, you'll hit somebody. So you cannot do it. You cannot do it as a hit program. So a hit program is typically done with a stationary cycle or with a skipping rope. Typically, you can do burpees, you can do push-ups, etc. But you have to monitor your heart rate. So that's a hit program. But outdoor cycling is a great cardio exercise. Different benefits for different dimensions of exercises.
And I thought the best exercise is swimming. Swimming, it gives exercise for all the parts of the body, all joints, all muscles. I think only problem is you cannot do every day and whole year, 24 by 20, all the year, 12 months.
That is so true. Another point that I didn't have time to cover is suppose you are doing a cardio and swimming, because it has got resistance while swimming, it protects your muscle better than running. If you just do running, your muscles can melt away because of the various things that we explained. But since swimming, there's a bit of a resistance component to it, it will prevent muscle loss. So from a cardio point, somebody is losing muscle, swimming is a better exercise than running.
Yeah, swimming is used as an, it's kind of this thing cross training for running.
Yes, in the knee joints.
So this hit, so one last question, this hit thing can you do for when you go on a walk?
You can, of course. It provides hit. People can use a hit as a while walking is only if you find that you are at the moment your fitness level is very low. So they told you to hit, you must get 80% of your maximum heart rate. Maximum heart rate is 220 minus 50. So if your heart rate, if you are now don't have much fitness, then you may find that just by brisk walking, you're hitting that zone. Then you're doing hit, as long as you're hitting that zone.
You can do a hit by walking, by carrying dumbbells in your hand. You carry dumbbells in your hand or a backpack with a weight, you can do hit while walking. You have to carry a 2 kg, 1 kg dumbbells in both your hand and replicate your walking technique, or put a backpack with 5 kgs and you can do your hit.
Yeah, absolutely. Yeah. So as long as you have the heart zone that matters, as long as you hit 80% of your target heart zone, then you are doing hit. But the thing about hit is you must not keep on doing it constantly. You do for some time, then you relax. Then you do for some time and relax.
Thank you.
Dr. Vijay's batchmate, Dr. Ashogan, is also here with us. Dr. Ashogan, would you like to say something?
Thank you. It's a great honor. I mean, it's a pride for me to say I'm his classmate. I cannot say he's my classmate. So there's a major difference in that. I'm Indonesian Indian, Tamilian. I'm in Jakarta. I'm a GP. So when Vijay started this a year ago, I was 104 kilos. I'm now 58
awesome.
years, and my weight is now about 87, 88. The only mistake which I have done, which I noted today, is I've noticed 20% of muscle loss, which I would say that is a little bit modified exercise which I have done. I did not follow 100% of what he has told, because as a GP, running around and all of those things. But nevertheless, I definitely feel better. Yeah, thanks a lot, Vijay. It's a great honor. Thank you.
Good to see you here, Ashokan. So nice.
Yeah, thank you.
And hopefully you'll be able to address the muscle loss. Very important that once you cross that honeymoon phase, then you got to be very, very careful not to lose muscle.
Thank you, Vijay. Thank you all.
So Vidya and RK, talking about all these people, can I just say one thing? Talking about all these people losing weight, maybe we should do a before and after Dr. Vijay's presentation,
Appaji, would you like to say something?
Yeah, definitely. Yes, madam. So I've been listening to him for last almost 2 years now. He just took it like a sort of a small step and started researching. He gave me a book also, the first on metabolism and other things. We used to debate a lot, but he has gone like miles ahead now. So I keep listening to his lectures, trying to follow whatever he says, but mostly not following.
Radhakrishna, your final words. I think no one else seems to have any questions.
Yeah, amazing lecture indeed, as expected, and as is customary from Vijay. I wish I heard this 20 years earlier. You know, I lost a lot of time.
Never too late. Never too late, sir.
I have only one point, Vijay. These exercises require motivation. You know, if there's anything to improve motivation, so for example, is it necessary that one should have a
Affair.
physical trainer or somebody like Timu, you know, to work together? That you know we just follow each other and you know wake each other up and monitor. Because to be on your own and to have a constant motivation is not so easy.
Yeah, I truly agree with that. The thing that is, you know, I worked with a lot of groups now, and the important thing is a peer group. Yeah. So
Exactly.
whether it is the hospital or whether it's your JIPMER alumni, you know, our MMC, you know, our batchmate Ashovan is there. A lot of others I see on the today as well. We're all on a fitness group. We are peers, and it'd be good if you have the same age group because things get simplified. And there's nothing like a peer group to motivate fitness. Absolutely nothing. So, Pata, what your classmates in JIPMER or colleagues in the hospital, the way to do it is to form a group, fitness group, and then everything will fall into place. That will be my
Yes,
advice.
sir. Totally, I know.
Trainer is not required. The fitness trainer is certainly not required. That is the extreme. Somebody wants to get into some sport, excel, etc. As long as I understand the simple principles, there's no need for a fitness trainer.
Totally agree, sir. But the age, the part of it is the group, peer group. This thing, for example, in our run group, me and my wife, we are the only two doctors, about 150 people. And we actually love it because I'm away from all the other doctors. I'm very happy about to be in this group. Okay. And the reason for trainer is like, do you want a teacher or not a teacher? You know, teacher will teach you. The reason your exercises, what you say, you may know, I may know how to do a core exercise. If somebody does the core wrong, or somebody does, let's say, a squat, even a simple squat can go wrong. They'll end up with an injury. And that's why I think it's better to train initially under someone who is known. For example, I do know everything, but I do not want to waste my time with my group. So we have a full-time coach who tells what to do. So sometimes it's good to have a Vadyar.
Yeah, I agree with that. Yeah, but the issue is, you know, when you take it to the next level, yeah. So somebody who's never been exercising is not going to get a trainer straight away, you know. So yes, there are some basic things available. You start reading before you, you know, find a teacher for that subject. So start off, then you may find a trainer coming in useful as the days goes on. Yeah.
How much would you recommend playing a sport rather than, I mean, now, of course, I'm kind of old, but at a younger age, I used to hate doing exercise for the sake of exercise, but I'm fine to go and play, you know, play
You
badminton,
want to
play
do
basketball.
sport and not exercise, right?
No, I'm just saying, what is the role for, you know, reducing the amount of exercise for exercise sake, and how would that work?
Well, Dr. Vidya, I think you didn't listen to my talk. So your calorie age is not your age. You're not old. Okay. Your fitness age is your Vo2 Max age. So you're probably very young than what you think you are. That's number one. Number two is that sport, yes, different sports will give you different facets of fitness. So again, common mistake to do is that you do one sport that thinking that everything will be taken care of that. It will not. To play tennis, for example, your cardio to a certain extent hit will be taken care of. But then you need to do weights, you need to do flexibility. So different sports, yoga, flexibility is taken care of. Swimming, flexibility is taken care of. So whatever you do, see about the four, which facet is taken care of. The rest you must concentrate and do. So as I told you, unidimensional doing exercises may not cause good, but more importantly may cause harm you. So we want you to do a good balance. So sport may take care of 1, 2, 3 facets. That's great. But what is remaining, you must find about it. And Dr. Vidya, you're not old by any means.
Totally agree, sir.
That made her day.
Radhakrishna, your final comments before we wind up.
Radhakrishnan, can I speak?
Yes, sir.
I'd like to thank Dr. Vijay Bose for an excellent presentation, and also thank Dr. Patta Radhakrishnan, Dr. Anand, and Dr. Vidya for calling me to be a moderator for this session. Actually, I love exercise and sports and all that, and still very active. So I was very happy that I got involved in this program, which involves fitness and exercise. Thank you, all of you.
Yeah, thanks once again, Vijay, and we hope to see you very soon at the third segment of your series of lectures. Thanks once again.
Thanks very much, and thanks for the opportunity. Thanks everyone for tuning in. It's been
Thanks. Thank you,
great
Jeff.
experience.
Thank you, everyone. Thank you, Vidya. Thank you.
Yeah. Good night, everyone.
Bye.
Stay safe, and we'll meet you next week again for another episode of Marvelous Medicine. Good night, and thank
Good
you.
night.